Well, there's no right or wrong answer to that one. We'd have to take each individual patient case by case and just see how the pregnancy progresses for a start and see if there are any complications that arise. So a vaginal birth is ideal, but there's also good reasons for caesarean sections.
We as a society are facing very big changes, and specifically we're having fewer children and we're having those children at an older age. And age matters a lot. Age matters, it's a grossly underrated feature with regards to how delivery will proceed, and specifically we lose elasticity, and to deliver vaginally relies upon elastic tissue. And when we lose tissue elasticity with age, the potential to labour and labour well declines. And so the older woman, and that's the trend these days, is women having their babies at an older age, they are more likely to labour poorly. And to go through a long, hard, difficult labour that's going to end in caesarean section is a pretty challenging, pretty difficult thing to undertake, which I'm more than happy for people to choose to do. But sometimes the wiser choice, guided by what happens during the pregnancy, is to say maybe that isn't the wisest thing to do. And the extreme difficulty of actually negotiating what is the right thing for the individual person is the real challenge. And the absolute top of the list in terms of what we do is what my patients would want to do. And so somebody who's really keen to deliver vaginally, come what may, I will try my hardest to achieve that for them, recognising there's a strong chance it won't be achieved, but nonetheless I would try. And conversely, I have been in the situation where I'm going, you really want to have a Caesar? I think you're going to be in the prime position to have the easiest vaginal delivery, but that's what you want to do. Okay, that's fine. It's such an individual thing. As I say, obstetric complications of various types can dictate management. Blood pressure, for example, is one of the things that might dictate how we do things. It's a very, very complicated answer.